Let's look at the software. The software is installed onto the computer. The software first analyzes the results from the different technologies and then provides the cross-analysis and modelling for the practitioner. In this first page, the doctor keeps a record of all the measurements from his patients. When selected, each patient's visits are listed on the right side of this screen, and the practitioner can access the results of any visit as required. To perform a measurement, the doctor only needs to record basic information from the patient: the name, gender, age, height, activity level, weight, and clinical context, if any. The measurement takes a few minutes, and the practitioner can immediately access the results. The results from the 4 technologies are displayed in separate windows. An additional set of windows will provide the practitioner with the cross-analysis of all results. To illustrate the technology and the type of cross-analysis indicators available, we will show actual scan results. However, all results should be considered in the clinical context of the patient's case history, symptoms, known diagnosis, current medication, treatment plan, and therapies. This first screen shows the basic components that have been measured using the different hardware. The EIS measurements are displayed with the electroscangram, ESG, and show the conductivity measurements, which provide the calculation of the sodium-potassium ATP as pump activity and oxygen delivery to the tissue. The EKG provides the heart rate variability, HRV indicators, in time domain and frequency domain analysis. The measurement of these indicators is shown in a scale, value, normal range, and units. Each indicator is further explained by clicking on the indicator name. The most important indicators are related to the autonomic nervous system activity, ANS, provided inside the frequency domain analysis section. One of them in particular is the ratio of low frequency to high frequency, where low frequency corresponds to the sympathetic system and high frequency corresponds to the parasympathetic system. The oximeter provides SpO2% with the original wave PTG and the acceleration of this wave named second derivative plasmograph waveform. The analysis of the PTG and SD-PTG provides a list of indicators, also displayed with the scale, value, normal range, and unit. Here, for example, the ratio -DA is one indicator of hypertension, and the ratio BA is an indicator of the heart left ventricle function. The bioimpedance analysis, BIA, provides the body composition, including the different compartments of the body. The body composition analysis, including fat-free mass, body fat mass, and water balance, as well as indicators for obesity diagnosis. Impedance, resistance, reactance, and phase angle. Diet and micronutrition advice is provided for a period of 4 to 6 weeks before the patient gets re-scanned. Then we have access to the cross-analysis indicators and the modelling of the body systems. Each body system is represented with an individual icon. Each of them provides the practitioner with a list of relevant indicators. For example, in the digestive system window, the practitioner can look at the conductivity of the different parts of the digestive system and the related indicators of the EIS system, as well as the autonomic nervous system indicators related to this body system. A follow-up icon allows the practitioner to monitor these indicators over time, visit after visit. In the cardiovascular system modelling, we can access various indicators like the blood pressure indicators related to the combined information from the plethysmograph, HRV and EIS. The arteriosclerosis and vascular indicators and the left ventricle function relate to the plethysmograph measurement. The heart conductivity indicators relate to the EIS and HRV measurements, and vagal syndrome relates to the HRV. Here we can access to all visits and follow up the different indicators according to the current treatment or change in lifestyle of the patient. If we go back to the patient page and by choosing two separate visits from the visit side for another patient, we will now use the icon that allows us to view the graphics side by side. The software analyzes the data and takes any updates into account each time to generate the modelling. The modelling side by side includes the full body modelling, as well as the cardiovascular system modelling and other body system modelling. According to the intended use of the ES Tech and in respect of the CE agreed market placement, the software provides the option to follow up hypothyroidism treatment, SSRI treatment, blood pressure treatments with beta blockers and converting enzyme inhibitor and anticoagulant treatment. In the case of symptoms and signs of ADHD children, the software allows the practitioner to visualize a profile of these children according to the conductivity of the frontal lobe area. Thank you for your time. This video is designed to introduce general awareness to the ES Tech complex. An exhaustive user manual and training will be automatically installed onto your computer with the software.